Hello, we are now at the world-class Medical Digital Technologies Laboratory at MEdRC EduTech, Somajagoda, Hyderabad, Telangana. It gives us immense pleasure. For the first time in the world, we talk about the concept of allergy and clinical immunology in a level where digitalization of medical education is blended with. When we talk about the concept of allergy, we should also understand that there are 40 crore Indians who suffer from different kinds of allergies. Lot of people think it's a common cold, it's a common sneeze, it's a common headache, it's a rash, it's a kind of shortness of breath. One important thing that everyone needs to understand that all of these symptoms are interlinked. When we talk about allergy, most important thing that you need to understand is not that you take a tablet of cetirizine and you just get out of the problem, or you just take any kind of an antihistamine and you think you get rid of that. There's something more that the people of this country realize, that than taking a mere antihistamine, than taking a kind of a bronchodilator for cases of an asthma, there is something more to be done in this. When we talk about this concept of allergy and clinical immunology, when we look into the Western countries, it is a lot more there. Let us try to see what exactly these people do in the Western nations. In the West, they see allergy as a disease where we call that as a linked with genetic wiring. We call this a condition of atopy. Atopy is a state where you've got a strong genetic wiring on and a possibility to get that particular allergic diseases to the progeny. In simple, if suppose your grandparents are highly allergic, the possibility of your parents getting allergy increases. And the possibility of, as a child born to such parents, there's a possibility of you suffering with allergy also increases. This we typically call in a scientific language as genetic wiring. In India, Allergy Asthma Network of India proudly says that it is first among the group of different organizations who works for the treatment of allergy and asthmatic diseases. Today, as we enter into a World Allergy Week, we all need to realize that it is purely important to understand the disease of allergy. From the level of treating the disease to the level of prevention of a disease, which is more vital. When we talk about prevention of a disease, you are taking the patient to the next level, preventing him to come back to the doctor again and again. This is what the West doctors or the hospital does. It is primarily important to understand the atopic status of a patient and then to identify which allergens are causing him repeatedly fall into the disease of allergy. When you try to conduct an allergy screening test to a particular patient, we try to analyze what kind of allergens he is suffering with. With the kind of allergy treatment, with the kind of allergy skin testing, when we go to a step of next, that identifying of allergens what he is suffering with, we try to make a list of it and try to explain to the patient what he needs to avoid. Avoidance of an allergens, which comes as positive in the allergy testing, is the important aspect in the treatment of allergy and clinical immunology. Lot of people in India, especially in some setups of medicine and paramedical stages or departments, fail to understand that the primary step of preventing a patient to fall up into repeated allergies lies in avoiding the allergens. Once you avoid an allergen, it is 50% of the job done. And the next 50% level goes into the chemotherapy aspects. Out of all these things, another advanced treatment is immunotherapy. Immunotherapy is something, a repeated induction or introduction of particular allergen in small divided doses in periodic times, wherein which after some time you totally become free from such kind of allergen if you get exposed the next time.